you need the link, we'll get that set up for you. At the end of the talk, we're going to go through the Facebook group. I have a private Facebook group I've set up for this. It has access to the 30-day eating plan. If you guys want to ask me questions there, if you want to post pictures of all the very healthy foods that you're cooking on there. It's kind of just a group you can, check in with me. You can ask me questions. It's just for like accountability, basically. So, yeah, just a little resource that we can use moving forward. Cool?
So we can go on the website?
Yeah, so there'll be a link at the end, but also as you guys are leaving, just check in with Zach, make sure we have an updated email address for you, and I can send you a link to get into the Facebook. You have to have a Facebook account to get into the Facebook group. So if you don't have one, you can make like an alias account or whatever works best for you. So we'll kind of go from there. You guys ready to enter the zone of anti-inflammatory eating?
Ready.
There's no going back once we start.
Oh man, no Culvers tonight.
Game on. All right, so has anybody heard the term SAD diet or standard American diet? SAD eating strategy. So basically, when we think in terms of inflammation and how it relates to what we're eating, it's kind of an all or nothing type of concept. So either what we're putting in our mouth is creating inflammation or it's creating an anti-inflammatory response. There's really no happy medium. Now when you look at like standard American diet, so this is basically what 80% of the population is eating in America. If you go outside of America, you go into other countries, it does vary a little bit. But ultimately, like what we're dealing with we look at nutrient content of our foods, we look at calorie content, and then we look at the ratio of omega-3 and omega-6 fatty acids. So when you look at what our diet includes as far as the standard American diet, it's very high in calories, so it's calorie dense, and it's nutrient poor. And then as far as the omega-6 to omega-3 fatty acid ratio, we're looking at anywhere from a 10 to 25 to 1 ratio, which we'll look at kind of what an ideal ratio is, but this is extremely high, and this is one of the primary things that pushes an inflammatory pathway in the body is the way that the body breaks down these fatty acids and the products that it produces as they're broken down. So if you look over here, this is kind of percentage based, like where the calories come from in our diet. So so you look at like 20% refined sugar, 20% refined grains, 20% refined omega-6 seed oils, 20% grain-fed feedlot chicken, eggs, and fish, 10% dairy, 1% alcohol, and then the other 10% are coming from fruits, vegetables, beans, whole grains, things like that. Does that seem about right to you guys as far as like dietary breakdown? Pretty close?
If I get my way.
Yeah, yeah, exactly. So if you think about this word here is pretty important as well, where it says refined. So when grains are refined, so you look at like white flours. So basically what happens is we take a grain, a whole grain, we grind it down, we basically strip it of all of its nutrient contents, and basically what you're left with is a very high glycemic, meaning that it can, once you put it in your body, it spikes your blood sugar rather quickly. So you're basically taking away all the fibers and things that are supposed to slow down the absorption of sugar into the body, and you're just kind of like making it so you're injecting sugars directly into the bloodstream. Refined sugars, you're looking at like your high fructose corn syrup, regular corn syrups, basically things, aside from natural glucose that comes from like fruits, like fructose, that comes from fruit. Refined sugars are just highly processed sugars that either have to be metabolized through the liver or elevate your blood sugars very quickly. Refined omega-6 seed oils, so this is kind of like your hydrogenated oils, your canola oils. These are highly processed oils that actually have a negative effect on the body, where you look at like the non-refined oils like your coconut oils, your olive oils, things like that, which are not super refined, and your body can actually utilize them as an anti-inflammatory method. Whereas once you refine the oils, you hydrogenate oils, it actually has a negative effect on the body. So something to think about. You guys with me?
Oh, yeah.
Yes.
All right. So this is our standard American diet. This is kind of baseline what a lot of us are starting with. Another good point is where it says grain-fed meat. So if you think about, you guys have heard of grass-fed meats or beef, chicken, different things like that. So why is it important to have grass-fed as opposed to grain-fed? What would you guys think? Why would that be important?
More
The same reason we
toxins.
shouldn't eat it.
Yeah, so basically, like if the animal is eating those products, it's getting injected into the fat around their, meat, supposedly, and we're going to be ingesting the grains from their fat cells. So what we're supposed to be avoiding, we're getting through the animal of what they're eating. All right, so let's take a quick look at this list. These are all conditions linked to the pro-inflammatory diet. You guys all got a handout. Now, I'm not going to be looking at your scores or anything like that, but basically the handout is...
Such nice pictures.
Yes. So the idea behind that handout is just to kind of spark a little bit of thought process into different symptoms you might be experiencing and your relationship with food. But ultimately, if you look through the literature, when it comes to inflammatory biomarkers or blood biomarkers, a lot of these diseases are directly related to elevated inflammatory markers in your bloodstream. Any of those look familiar?
What causes fibromyalgia? I hear the word a lot, but I don't know.
So fibromyalgia is it's a relatively new disease state. And what they're finding is it's mostly an inflammatory response in the body. So it's a hyper-inflammatory response in the body. And symptoms right now, the diagnostic criteria are widespread joint pain. So joint pain in multiple regions of the body, sleep disruption, and then like mood disruption. So like depression, depressive states, things like that. It used to be a diagnostic criteria where you'd have to have like certain tender points throughout the body, like so many out of like, I think there were like 30 different tender points. You had to have so many positive tender points. They moved away from that diagnostic criteria to be a little more vague. Since the drug Lyrica became FDA approved, they kind of changed the diagnostic criteria to open it up a little bit more for people. Because Lyrica used to be like a nerve type medication, where now they're using it for like fibromyalgia. They've been using it for chronic pain patterns, depression, anxiety. They've kind of blown open the gates, so I think they changed the diagnostic criteria a little bit to allow for more prescriptive availability. But it's a real thing, and they used to think that it was like nervous system hypersensitivity, but they're actually finding that it's more of just like an underlying low-grade chronic inflammatory state. So yeah, does that answer your question? Okay. Well, yeah, basically all of these things have been linked to increased, basically inflammatory foods that we're eating. Now, like the things that we're looking at, the anti-inflammatory diet, they utilize a lot out of Cleveland Clinic, which is probably one of the more prominent clinics in the nation right now. And it's more of like a functional medicine style of treatments that people are utilizing. So functional medicine looks at lifestyle medicine. So what are the things that we can change in our lives? So you look at nutrition, hydration, sleep, social interactions, different things like that. So the things that we can change versus just trying to block a symptom with a medication. So when we think of like anti-inflammatory diet, you think of inflammation, it's probably important to think of like what is inflammation in general. So I'm sure we all have heard like inflammation is like the classic cardinal signs of inflammation are what? When we think of inflammation, what's something you think about?
Swelling, redness.
Yep. Pain, swelling,
Yeah.
heat. So yeah, all those things are pretty classic signs of inflammation. Now, if there's a low-grade chronic state of inflammation, a lot of the times what's happening now is we're not going to be getting those overt symptomologies, right? So redness, swelling, things like that might not be present. So somebody who has chronic heart condition, a heart attack, they call that the silent killer. Why?
Doesn't make any noise.
Doesn't make any noise. You're not getting those symptoms. And then one day your heart goes into arrest. So the inflammatory process is, we're starting to think about it a little bit differently in terms of, all right, those classic jump out at you symptomologies where red heat, swelling, pain, they don't necessarily have to be there for there to be an underlying level of inflammation. Now, what could happen is that you have this low level of inflammation, and then over time it builds and builds and builds, and then you start having symptoms. So there might be little changes in your blood biomarkers. There might be different changes like that that goes under the radar before you actually get symptoms and start noticing something. And by that point, your body's kind of like in a crisis mode, and now you have to work a little bit harder to kind of get everything to calm down. Yeah, so just thinking of it a little bit differently. Now, things like lack of sleep, increased stress levels, like mental, emotional stress levels, those can all release similar chemicals and create inflammatory responses similar to like infection or trauma, which we don't really give enough credit to, like the mental, emotional aspect of inflammatory responses. But the reality is that there's many different triggers for inflammatory responses in the body. Nutrition is basically one of them, out of probably 3 or 4 others that we did talk about. But tonight we're going to focus mostly on what we're putting in our mouths. All right, so this was a very interesting study that we found. So degeneration without physical trauma. So I like this slide because a lot of patients will come into me like, you know what, I just woke up one morning and like my shoulder was killing me, I didn't do anything. Why does my shoulder hurt? Or why is my knee killing me? I didn't do anything and it's just super swollen, red. Why is that happening? So what this study showed is when we looked at, well, there's BMI and then there's waistline measurements basically. So when they looked at baseline waistline measurements, so in men with waistlines over 33 inches, women over 28 inches, you're at an increased risk for developing patellar tendinopathy. So that's basically tendinitis of your knee, that little tendon that goes right at the front of the knee right there. So basically what happens is that this fat accumulation is associated with a higher level of chronic, low-level inflammatory responses. So basically tendons and ligaments can degenerate because of these low-level systemic inflammatory responses. Your tissues, your tendons, your ligaments can all start to wear down without any kind of physical trauma. That's kind of wild, right? That was a big eye-opener for me because basically what that means is if you're getting things where pains, aches, crick in your neck, you woke up one morning like, I didn't do anything, it just hurts. Basically what that means is there's a low level of inflammation going on in your body. And the inflammation has to be addressed before you can actually, you can treat the area, but you're not really addressing the root cause of the problem. You guys hanging in there? This is a lot of fun stuff that we're getting into. But like I said, I think we're going to open our eyes a little bit to some certain things. Come on now. There we are. Work with me. All right. So this right here is basically how inflammatory responses can eventually lead to disease. So we start in the middle of the circle here. This is number 1. So this is a pro-inflammatory diet and lifestyle. So that can be eating a standard American diet, not getting proper sleep, not getting proper hydration, not getting proper movement. And then what happens is slowly but surely all these blood markers start to increase. Now these are different interleukins, tumor necrosis factor, prostaglandins, specific C-reactive protein. All these things are inflammatory markers that can be tested in the bloodstream that you'll see kind of flying under the radar will start to increase. So once these blood markers start going up, Then we start to see physical manifestations. So we see like vitamin D deficiencies are coming up. We start to see this imbalance of blood lipids. We see the waistline starts to increase. Blood pressure starts to rise. BMI goes up. Hemoglobin A1C will go up. Blood sugar dysregulation. People are taking over-the-counter medications like antihistamines. We're taking anti-inflammatory medications because we're just achy or things are hurting, and that is blocking these inflammatory pathways that are just low level going on in the body all the time. And then eventually what will happen is we end up going to disease state. And all these different diseases, again, are directly related to inflammatory conditions. Low-grade inflammatory states that are directly related to inflammatory lifestyle. There we go. Just turned off on me. See, you know, technology is a fantastic thing. Here we go. Play. In review, there we go. All right, so what are some of the indicators of inflammation? Okay, again, we talked high blood pressure, waist circumference, lipids. So if you go to your doctor and your blood lipids are off, your LDL, HDL ratio is off. Hemoglobin A1C is a long-term marker for blood sugar elevation. So that's something they look at for like metabolic syndrome, type 2 diabetes. BMI, which is basically, it's an okay measurement, not my favorite, but it basically looks at like height and weight, and you get a calculation from that. Low vitamin D is a big one. HSCRP, so that's an inflammatory marker that you can take in the bloodstream if that's elevated. Again, hip-waist ratio, and again, just history of utilizing over-the-counter medications to treat poor health. All right, let's get down into it. So we're going to break down the difference between pro-inflammatory and anti-inflammatory diet. So on this side here, we're going to see basically all the things that create inflammation. So you're looking at your refined sugars, you're looking at refined grains, trans fats, and then your refined seed oils. Now on the other side, so it's kind of like, oh man, we got to take all this stuff out of the diet. What can we eat? So let's focus on what we can eat. And now we have all of these things here. So ultimately what we're looking at is what? Fruits, vegetables, nuts, seeds, berries. Now, dairy products are kind of it's a gray area. Not everybody responds well to dairy products. And if you are doing dairy products, it's using them more like a condiment than an actual, like a side dish, right? Like a block of cheese, probably not the greatest. Now, if you use it as a condiment, you can get the beneficial fats from it. Now, it's probably important to look at, you know, is it a grass-fed dairy product versus a grain-fed, traditional, right? So what is the animal that gave you that milk eating? So that's something you want to kind of think about if you are using dairy products. So it's better to go grass-fed, organic, and you'll actually get some of the omega-3 fatty acids through those versus more of the omega-6, like grain fatty acids that the animal was eating. So if you are doing any dairy product, if you can handle dairy products, just make sure that it's a super clean dairy product and you're only using it as a condiment, right?
A cheese sandwich isn't exactly a condiment.
But what's the bread made out of?
That's actually pretty good.
Yeah? So typically you're looking at your grain and flour products at that point. So now the sandwich, if you do it as a lettuce wrap, that'd be a little bit different. Or if you're utilizing a gluten-free, grain-free bread, so you could do like a brown rice type bread, that's a pretty decent substitute. Brown rice probably has one of the better amino acid profiles when it comes to any type of grain. So if you are going to use any type of grain, brown rice is probably one of the better ones to use. White rice, again, now you're stripping the rice of the fibers that you need to slow down the blood sugar elevation that happens when you eat that product. So white rice, as it is gluten-free technically, it will spike blood sugar rather quickly. So it depends on the kind of bread. So if you're doing like a whole grain bread, like
It's sourdough.
Yep.
A whole grain.
so whole grain bread, like again, you are getting more of the inflammatory aspect of that from the grain, right? So all grains are going to lead down inflammatory pathways. So bread is one of those things. Breads, pastas, those are the things that typically are the hardest to get away from. We're going to show you a slide later as to why that is, why your body is so hard for you to get rid of that kind of stuff.
Because it tastes so good.
It tastes so good.
Red wine. So red wine and beer is good.
Stout.
Oh, stout beer.
Yep.
Yeah,
Yeah, so as far as alcohol is concerned, some alcohols can have an anti-inflammatory effect. Don't get too excited though. So there's what we call a hormetic effect with alcohol. And what research shows, so hormesis basically means that we can apply stress to the body at a low level and actually has a beneficial health effect. So stressors like heat, cold, things like that we can use for beneficial effects. Same as alcohol. Now it was, I think, 3 to 4 drinks for males, 2 to 3 drinks for females, which is kind of that hormesis effect.
a week, right?
A week?
A week?
Actually, per sitting.
Sitting.
Yeah. So again, like
That's what better
people
to
can
do.
get a little
So-
carried away with that too. There's a lot of calories in alcohol as well.
Yeah.
So I try to tell people like moderation is key on that one. If you're using alcohol as like, oh, it's my vitamin for the day, like, you might be entering that like negative effect versus positive effect. But these are generally like made as an anti-inflammatory pathway. They're not using a lot of grains in them, right? So that's kind of why they're on this list. Oils. So positive oils, olive oil, right? Very positive oil. You get a lot of good beneficial fats. Coconut oil, probably one of the better ones that you can use to cook at higher temperatures. It has a very high smoke point, so you can actually like fry or do things like that with that or cook at higher temperatures. Butter, so real butter, again, grass-fed, better than, like not grass-fed butter, traditional butter. Avocado oil, bacon, oh man. So bacon's on there again, like looking at the source of the bacon's very important. So you're looking at grain-fed animals versus pasture-raised or grass-fed animals. So again, the source is very, very important. Let's look here. So omega-3 seeds, these are some really good sources of omega-3 fatty acids. Hemp, chia, flax, all of those things are going to be beneficial fats. So if we're trying to balance that omega-6 to omega-3 fatty acid ratio, these are really good oils to use to kind of bump up that omega-3 side. Nuts, dry roasted or raw. Tubers, you're looking at potatoes, yams, sweet potatoes. White potatoes typically are going to be a little more higher up on like the glycemic index, so they can spike blood sugar. So if you're going to be doing potatoes, it's better to do like the darker potatoes, the purple potatoes, sweet potatoes, things like that. All right, we'll touch a little bit more on this moving forward. Any questions on that one so far? All right, so let's dive into this omega-6 versus omega-3 fatty acid ratio. So we should be aiming for more of a 4-to-1 ratio, where the standard American diet, when we first looked at it, that was upwards of 10 to 25-to-1. So we are way off the mark when it comes to omega-3 to omega-6 fatty acid ratios. So I think it's important for most people to be either supplementing with omega-3 fatty acids or really like doubling down on what they're eating. So increasing, wild-caught fish, hemp seeds, flax seeds, all those kinds of things, olive oils, all these things are going to help to balance out that ratio. Looking here, these are some interesting points. So these medications that people are typically taking are basically designed to block the pathway. So there's this arachidonic acid, which is basically produced in the body by high omega-6 fatty acid products. gets converted into something called arachidonic acid. So when we take Advil or other NSAIDs, they block an enzyme that basically stops arachidonic acid from converting into prostaglandin E2. When we take aspirin, it inhibits arachidonic acid into your thromboxanes, which are an inflammatory chemical in the body. Like when you're sick, your body releases these types of inflammatory products. So these are the ones that kind of make us feel like crap. They make us feel achy, they make us hurt. So when we take these medications, we're basically taking this arachidonic acid, which is elevated because our omegas are way off in the body, and it's trying to block these pathways. Singulair is an antihistamine that we use for seasonal allergies. Again, that blocks arachidonic acid production into leukotrienes, which is another chemical that the body produces, which increases histamine. So we're basically combating things that we're increasing through our diet by using pharmaceuticals to reduce inflammatory process. Kind of crazy. All right, so this is an awesome chart here. So I'm going to help you kind of work through this a little bit. On this side, we see what's called linoleic acid, which is our omega-6 fatty acids. That's what's found in your whole grains, soybeans, peanuts, safflower, sunflower, cottonseed oils, corn oils. If you look on the back of any product that's in a box or in a can, you're most likely going to find one of these products here. All right. So corn oil, cottonseed oil, sunflower oil, safflower oil, peanut oils, soybean oils, whole grains. It's in most of the products that we have in the supermarket. So that's our omega-6 fatty acids. All right. So this comes down our pathway here. So GLA, DGLA, these are just different fatty acid pathways. Then eventually we end up turning into anti-inflammatory pathways. So in a perfect world, these would actually get converted into anti-inflammatory prostaglandins and thromboxane. Now if we were to go into this direction, what actually will stimulate this is insulin. Now, if we eat refined sugar, refined flours, and then omega-6 fatty acid oils, we basically are going to trigger an insulin response, right? So when insulin is increased, or we're taking statin medications, that's going to push this pathway across to arachidonic acid, right? So most of us, if we're eating a standard American diet, our blood sugar levels are way off. So when blood sugar gets elevated, what else gets elevated with it? Insulin. So insulin is a chemical in the body, or a hormone in the body, that basically opens up your cells and lets blood sugar come in. All right, so when insulin is elevated, we're basically pushing the pathway away from anti-inflammatory into the inflammatory pathways. So once we have that arachidonic acid, now we're going to start to create all these inflammatory, pro-inflammatory chemicals in the body. And that's where, like, if we're taking the NSAIDs, it blocks this pathway. If we're taking aspirin, it blocks this pathway. If we're taking Singulair, it blocks this pathway, right? Now, if you're looking at grain-fed meats like chicken or omega-6 eggs, farm-raised tilapia, catfish, all of those go directly into arachidonic acid pathways. So there's no opportunity for it to come down into this anti-inflammatory pathway, even if you aren't, you don't have hyperinsulinemia, your insulin levels are fine, you're not taking statin medications. If you're eating these types of things, it just goes right into this pathway. All right, now on the flip side of that, over here is our omega-3 fatty acids. So green vegetables, hemp seeds, chia seeds, flax seeds, grass-fed meat, chicken, omega-3 fatty acid eggs, wild game, fresh fish. All of these things are going to be over on the omega-3. All right. All right. So a guy like, man, I feel like crap for like the first couple weeks. Yeah, your body's going through some changes. And chemically speaking, you're not getting those dopamine hits that you're used to, and your body's actually going through a withdrawal process. That's pretty wild. So it's good to know that going into something that you're probably not gonna, you're gonna feel different. You're not gonna feel great. You might feel kind of achy. You might feel kind of jittery, or just like have sleep disruptions, things like that within the first couple weeks of completely changing around the diet.
Or just crabby.
Yeah, it could be crabby.
Better watch out.
Absolutely.
Better watch out.
So it's tricky, and for some people it might just be like, instead of like fully jumping in and getting rid of everything all at once, tapering yourself off. And that's kind of like, we'll talk a little bit at the end, like it's better to kind of like go through your pantry, start taking things out, finishing up things that you have. You don't necessarily have to throw everything away, but just kind of like prepare yourself, like start weaning
Give it
off
to your
these
dad.
things.
You don't give it to your daddy.
Yeah, give it all to dad, and he'll be fine.
That's what my dad said he's gonna do. He said he's gonna eat through it.
I'll take care
He's
of all
not
the
getting rid of it,
Twinkies and
he's
the
gonna eat through
Ho-Hos
it.
and. All right. So this is an important concept as well. What's the main driver of inflammatory processes in the body? Sugar. So I love when patients are like, yeah, I'm all good, I'm going anti-inflammatory, I got my boxes of gluten-free cookies, my grass-fed organic milkshakes,
Just the greenwashing.
I'm set, we're good. A gluten-free organic cookie is still a cookie. It's still gonna spike your blood sugar, because remember, even if you're not doing the grains, like the sugar drives insulin levels up. So even if you're eating like plant-based things that could be beneficial, they could still push it into that inflammatory pathway. So sugar is a big one. When insulin levels get off or blood sugar raises, that can still push things in the right direction. So seeking foods that are nutrient dense with vitamins, minerals, that should be kind of like the key. Not necessarily finding substitutes for things that are crappy, that are still kind of crappy, but a little bit better, especially when they're higher in sugar. Now the problem with sugar is that it's going to be hidden in many, many different things that disguise themselves as healthy, like granola bars, things like that, gluten-free, this, that, low-fat foods that are going to have so much sugar. And I don't know if you guys have ever heard, there's a movie, it's called That Sugar Movie. You can find it on like YouTube. But basically, it's kind of like how the guy did like Super Size Me, where he kind of like ate McDonald's all the time. This guy was like, his goal was to try to find foods that didn't have sugar in it. And basically, he was eating all these healthy foods like yogurts and granolas, and basically finding like there was as much sugar in those as were in like candy bars and cans of soda. So it's very important that when you're looking for foods that are healthy, that you're looking at the sugar content. The best way to go about this is if you're looking for healthier alternatives, is to start making your own foods. Start making your own condiments. If you're going to be doing like gluten-free breads, like actually making your own gluten-free bread, so you know what's in there. Because a lot of these processed foods are going to have sugar in them. Why do they have sugar in them?
It tastes good.
Because it makes it taste good, and you're gonna buy it again. And your body's gonna be, I mean, food industry knows what they're doing. There's gonna be an addictive quality to it. So let's look at here. So this is like a Gatorade or something like that, like a sports drink, right? 8 teaspoons of sugar. Sesame snaps, little crackers, 3.5 teaspoons of sugar. Baked beans. Basically in half a can, 2.5 teaspoons of sugar. What we got here? Honey teriyaki sauce, chutney. We got low-fat mayo, teaspoon of sugar,
Go for the real.
right? And basically 1 tablespoon of low-fat mayo, you got a teaspoon of sugar. Crazy. So we got fruit toast, so that's probably like raisin bread or something like that. 3 teaspoons of sugar.
What is this little bowl of yellow stuff? I can't tell what that is.
That is orange juice.
Oh.
Big one. So a lot of fruit juices are very high in sugar. So if you're doing any kind of fruit juice, you gotta be careful of like, if it's, there's no pulp, there's no fiber in the juice, you're basically just injecting sugar into your bloodstream.
What about Coke?
No.
Coca-Cola?
Yeah.
That's way up there. So I think Coca-Cola last time, it's around like 38 grams of sugar in 1 can of cola.
I think it's more than that.
It's up there, man.
Yeah.
It's pretty, it's basically like sugar, and it's not real sugar typically. You're gonna be using like
Corn syrup.
high fructose corn syrup, and now there's other negative effects from that because now it has to be processed by the liver. That leads to fatty liver disease, a lot of other problems.
So when you're looking for like a juice,
Yep.
what's the healthiest, I guess, like, because I have seen like pulp and then no pulp, and I thought, pulp is better then, right?
Yeah, so if you're looking for a juice,
Water.
you're looking more
Water.
vegetable,
And a piece of
yeah,
fruit.
veggie juices.
Yeah, water
Yep.
with cookies is way to go.
Celery juice.
Celery,
Oh,
Cucumber juice, or
I
water.
like cucumber.
Yeah.
that's really good for you, but
It
it's
can be.
still celery juice.
It doesn't taste the
Or
best.
what about the cranberry juices
I love
that
cranberry
are,
juice, yeah.
that don't add sugar? Like
Those gonna be lower
Lower.
sugar content. Yeah. So typically berries, things like that, are gonna have a lower sugar content. But generally speaking, it's best to avoid juices in general, unless you're doing vegetable juices, right? Because vegetable juices now you're getting more like mineral content, and that you get a higher volume of mineral in the juice. If you're eating fruit juices, it's better to actually just eat the whole fruit itself because now you're getting the fiber from the fruit. And if the fruit does have pulp in it, that does have some fiber, but it's already kind of broken down, your body's gonna start to pull the sugars a lot quicker. So yeah, juices aren't the best, unfortunately. Yep. But kind of crazy, and I give you guys the job of kind of like going through the grocery and look for foods that kind of claim to be health foods and look at the sugar content on them. Yep.
Delicious.
Mmm. Shots of lime juice. That's the good stuff right there.
Wow.
So what's the best strategy that we can do? So obviously we want to eat more of an anti-inflammatory diet, right? So rather than focusing on what you can't eat, it's good to focus on what you can, because you're going to find that that's going to open things up a little bit more than trying to restrict yourself. Focus on what you can eat. Now, as far as supplementation is concerned, vitamin D3, again, we saw low vitamin D levels are associated with a low-grade inflammatory response. So at the beginning of starting supplementation, if you're not used to it, you could do 20,000 IUs a day safely for about a month or so. And then as you get your levels balanced out, you're checking your blood levels and they are at a good balanced level, you can go to 5,000 IUs per day as kind of a maintenance dose for adults. Omega-3 fatty acids, very, very important that you're supplementing, but also really pushing those foods that have omega-3 fatty acids like your hemp, chia, flax, right? All those types of foods. Omega-3 fatty acid eggs, you have grass-fed. Anything that's grass-fed is going to be higher in omega-3 fatty acid content, but also supplementing with these. So the EPA, DHA, those are great to supplement with. Your fish oils, capsules, all those things you can supplement with. 1 to 2 grams per day is what's recommended as a supplementation, which is a fairly high dose if you think about it. Most supplements you're looking at maybe like 250 milligrams, 500 milligrams per like 2 capsules. So there's some brands that you'll be able to get like 1 to 2 grams per dose. Designs for Health is a company that I like to use. They have like a liquid version that doesn't taste terrible. There's capsules. Nordic Naturals is another company that you can find over the counter that has relatively higher amounts in their product per dose. Sleep regulation is going to be a big one. That's pretty much a whole nother talk. It's kind of how do we regulate sleep, what are things we can do, but basically trying to practice good sleep hygiene. So turning off blue light things, within a couple hours before bed. What happens when we're staring at blue light? It actually prevents the production of melatonin in our brains. It makes it hard for us to get to sleep and stay asleep. Stress management, so if you're dealing with physical pain, right, addressing it. So a lot of you guys are here in the office, you're treating physical manifestations of pain. So if it's inflamed discs or inflamed nerves or sprained strains, like those things can create stress, which actually will push inflammatory pathways. So make sure you're dealing with that, dealing with mental emotional stress. proper coping mechanisms, talking to a therapist, surrounding yourself with positive social interactions, things like that are very important for mindset and stress hormones, which can actually lead to inflammatory pathway production. And then, obviously, dietary stress. So the standard American diet is a form of stress, which we don't really give enough credit to. And the body treats that as if it's a physical trauma or infection or mental emotional stress. It's all the same type of reaction in the body. All right, so we have to hit it from different angles. I think diet is a big one for a lot of people because we're just stuck in a habit. Our bodies, we're addicted to these types of foods that are not the best for us.
And it's really hard.
It's very hard.
Like when you go to eliminate and get healthy food,
Yeah.
what,
Yeah. You have to go through an adaptive phase. You have to create a new habit. You have to desensitize your taste buds that are used to high fat, high sugar, high salt foods that are very stimulating to your taste buds. So when you eat healthier foods, it's not going to taste very good until your body has an opportunity to reset.
it never tastes
Yeah.
good.
Well, you have to have an opportunity to reset your threshold for those things. So if your threshold's way up here, your body's not going to be satiated until you hit that threshold. So you remove the high levels of sugar, fat, salt, your threshold is going to start to drop. And things that didn't taste good before might start to taste a little bit better.
You said something, there's an addictive quality, particularly to sugar,
Yep.
and that it releases similar to a,
Dopamine effect. So
Dopamine.
like cocaine was the study that they did it on. Yep. All right.
Oh,
So.
good, it starts February 1st.
Yeah,
Yep. So.
we got 3 weeks to be back.
Yep. So if you're interested in kind of doing this as a group, I'm going to have this open to the office. So people that weren't able to be here tonight, we'll get them the link to the talk. We'll get them the lecture. So we're all going to be basically meeting in this Facebook group. And we're going to start February 1st. So for right now, what I would recommend doing is going through your pantry and seeing what's refined flours, sugars, oils, and start kind of removing those things and replacing them with different options. So it's going to be a bit of a process, and we want it to not create as much stress as possible because increased stress can lead to inflammatory processes. So we want to make this as stress-free as possible. There's going to be some stress associated with it. It's just a natural effect of taking yourself off of something that's addictive. So it's a process. So what do you guys think?
Well, the third bullet, caffeine, we can just,
Yep.
we can have green tea or black coffee, like
Yeah, you
a
can.
little bit, okay?
Yeah, like a cup or two a day, totally
Yeah.
fine. Green tea is great. It has L-theanine in it, which actually helps with like the hyper effect of caffeine and like the jitteriness that you get from it.
Okay.
So if you're drinking like 4 cups of coffee or big grande, like Starbucks, mocha, bocacino, whatever, you know, I'm talking about like the
Or
things
like
that have
12
like
Diet Cokes.
50 grams of sugar in
Oh,
it.
would
Like,
that be?
yeah, start getting off of those for the most part. And just, you know, the big thing is like, get ready to commit and like just do it. It's a 30-day process, and the whole purpose is to create a new habit. And the habits aren't gonna stick after a week of doing something, where that first week you're probably gonna be going through withdrawals, be like, this is terrible, this sucks, I'm going back to Burger King, screw this.
Culver.
Right, here I come, Culver's, cheese curds, game on.
I love cheese.
Someone said though, what about diet sodas? Like,
So bad.
So the problem with
Coming from
artificial,
adults.
so that's, yeah, so there's refined sugars and there's artificial sweeteners. Artificial sweeteners like aspartame, sucralose, they don't spike your blood sugar, but they actually trigger an insulin spike.
okay.
So same exact
Also
thing
can
when,
be poisoned
when your
by
insulin is.
aspartame.
Yeah, so aspartame is linked to Alzheimer's, seizures, things like that, like neurodegenerative
calling my name.
diseases. Sucralose, linked to leukemia in animal studies.
Good stuff.
Sucralose is actually a chlorinated sugar alcohol. So
Okay.
you're actually ingesting
say
chlorine.
that again?
It's a chlorinated sugar alcohol, sucralose.
It's
So,
Splenda.
Yep,
Oh,
yep,
okay.
Splenda.
Interesting.
Yeah,
You know-
aspartame's like your sweet and low, stuff like that. It's
Trying
wild.
to talk people out of that stuff, it's impossible. I have
Yeah.
a friend, he's type 2 diabetes,
Sure.
so he takes all this,
All these
Like-
medications, but, you know, finishes
No, and
off with
the,
some Diet Coke and,
the diet,
There's alternatives, but they're expensive.
yeah, so
They're
you
just
you
not
look
the
at
same.
different alternatives.
Going on at the house, I guess.
Run, go!
Little emergency.
Yeah,
See you guys
so
tomorrow.
the sugar alternatives, so there are ones that, like, there's like xylitol, there's erythritol, like,
Oh, that's awful.
I've seen the xylitol to
Yeah.
like bake with
Yeah.
as an alternative.
There's like stevia,
Just be
which is
careful,
like
because dogs die
Yep.
from that.
yeah, stevia.
Really bad, like a little tiny bit will kill a dog.
Yeah, I would be careful, like on
Oh,
animals,
wow.
like not great. Xylitol.
It's in a lot of gum.
It's a lot of.
Yeah, and there's actually
Toothpaste.
beneficial, there's like antimicrobial effects you can get from xylitol. You eat too much, you're gonna act as a laxative,
Oh.
so.
Okay.
Uh,
Wow, these are all really.
yeah, where do I sign up? But for some people, like it helps to satiate that, like the sugar response, like it hits the same receptors, the sweet receptors on your tongue, so you get a similar like brain pathway response. So for some people that are really stuck on sugars, like that's a good thing to kind of get them over the hump, but then eventually you just stop using that stuff. And you get the natural sugars from like fruits and things like that. Like raw honey, grade D organic maple syrup, blackstrap molasses. These are like natural forms of sugar that are okay in small amounts. What else you got? Any other questions, concerns?
No,
There's no easy way around it. The breads, the pastas, all
we
that
have this
stuff.
discussion
Mhm.
every day.
Yeah.
I
Yep.
lose.
Now you just have to hear it from another source. Be like, hey, Dr. Allin said, and you're like, what? I've been telling you that for.
She's been quoting you already.
Yep. So that's, hey man, next step is just taking that step. You know, go through your pantry, look through there. And don't beat yourself up, that's the big one. If you're going through a pretty big life change, like trying to go these directions. Some of you guys have probably tried doing something like this here or there, like you made it so far. Now there are like little fine details, like somebody might not respond well to dairy products, or they might have an allergy to like sulfur containing foods like garlic, onion, different things like that. So if those things start to pop up, that's where like the Facebook group, like, hey, Dr. Allin, like you could even like private message me through there if you don't feel like you're saying like, I had really bad gas after eating this. Like you kind of, you know, let me know on the side and I'll kind of work you through it. But there are little fine detailed type things that you can like really get nitpicky about, like, you know, like nightshades, like peppers and potatoes and tomatoes. Like some people with autoimmune type conditions don't do well with those, and you have to remove them from your diet. But a lot of the times, like my point is like, if you focus on fruits, vegetables, nuts, like real whole foods, you're gonna have a better response than if you're eating like Snickers bars and Big Macs every day.
I know you said like berries are generally like a
Lower
lower.
glycemic index.
But are you, for this particular diet,
Mhm.
are any fruits open?
They're open.
All,
Yeah.
like any fruit?
Yeah.
Okay.
Just don't like pound 10 bananas and a bag of grapes every
Or like a
day.
big pineapple?
Right.
Or-
Yeah, because you
Those-
cut the pineapple, you eat the whole damn
Right.
thing.
Yeah, because those are going to have a little bit higher sugar content. Your
Okay.
blood sugar will respond to that, and with that comes the insulin elevation.
Okay.
You like papaya?
I love papaya. It's good stuff.
So regarding bread,
Yeah,
whole grain doesn't sound good, right? How's whole wheat? I know white bread.
Whole
is
wheat's the
like-
same as whole grain.
It's the same thing.
Yeah.
Whole grain is
Yeah, there's no bread.
You gotta give up on the bread. There's
yeah.
no fake bread that works, it's all.
Yeah. Yeah, and like that's the thing. You can try to substitute with like brown rice, and like the
It's not
gluten free.
worth it anyway, at
It's
that
not.
point,
It's not the same. It's
Really,
not.
keto bread, all that new stuff? is
It's
like-
all.
You can try it. Like sometimes again, like a
None of the
substitute.
keto bread is actually keto.
It might get you to the point where like, God, ugh, this is terrible.
Yeah.
I'm never eating bread again. Like that might help.
Maybe
you.
that would be good, yeah.
Yeah, it might help you. And some of the like some of the brown rice breads, if you toast it, just right, it kind of satiates
Sure.
like same brain wave, but you're not
You
getting
could
the
make some bread
glutinomorphin
out
from
of
it, so you're not
almond
getting
flour.
that same like hit that you
Okay.
get
But
from
It
regular.
wouldn't be
It
yummy.
wouldn't be that good,
It's not
but you
marketable.
could do
Yeah, there's
it.
really no way around it, man. So
I told
doing
you
like
to make
lettuce
it.
wraps, things like that are like the best way around it.
Burnt bread.
Is there a best of the worst kind of bread?
Brown rice, like that's the best like gluten-free, grain-free type bread. And there's other like potato breads, potato starches, but again, like you're kind
That is
of dancing on that
high glycemic.
line of blood sugar elevation when you're doing that kind of stuff.
Gotta make it yourself.
Yeah, right.
Yeah, and again, like you bake it
Figure out your
yourself,
almond
you
flour.
know the
Gonna be
sugar
selling right on
content
the
that's in it, because a lot of like the gluten-free breads and things, you look at the sugar content on them, they're gonna be really high. So you gotta be careful. So it's great to experiment, like look into like paleo cookbooks,
I'm gonna start
keto type
selling food on the street.
cookbooks, those are gonna be all good things that are grain-free,
Oh.
and give you some
I think
ideas
those
for like
would be good
snacks and
bread.
stuff like that.
Where does the fiber come from? The vegetables then, if you're
It's
not
like
using
an
anything?
anything.
Yeah, absolutely.
Okay.
Yeah, tons of
That's
But
your
plant
main source
products.
of fiber.
That's where the fiber's gonna come from.
And it says,
Yep, 100%. And you can do fiber supplements
flour.
too,
the coconut
if
flour.
you're not getting enough of that in
It's
the
not,
beginning.
it's keto.
So
That's the best part, I
smoothies, things
think.
like that, you can kind of like put in
Kitty bread.
different like fiber,
I'll be honest with you, it
like
wasn't
psyllium husk is
She
a
didn't
good
even
fiber
have
to
it.
use.
I took it
And
to
then
work.
doing like collagen that gets like more protein, like you can kind of balance out your lack of like proteins, fats. You can put like coconut oils, like hemp oils into smoothies. Like those are a great way to like balance out the lack of either calories, proteins, fats, like the stuff where you're not just gonna eat like spoonfuls of coconut oil to get your like regular fat levels. So those kind of things you can kind of blend up into like smoothies and things like that. What else? Any other questions?
I used to
Concerns?
take this drink, it was like a breakfast drink, it
Mhm.
was all plants, and it was horrible. It really was, but, I assumed that it was healthy.
Well, usually if it tastes horrible at the beginning, it's probably more healthy than
It
than
tastes
not.
horrible.
Yeah, there's a lot of different like smoothies and things you can make in the mornings. Like for me, I like to do like almond milk. I'll do like almond milk with collagen, like cocoa powder. I can even put some like avocado in there, which sounds gross, but it gives it a good consistency. And then you're getting the beneficial fats from that. Yeah, you can play around with a lot of different types of things. But it's all about experimenting, stepping outside your comfort zone to find something you might not knew that you liked.
I won't even go there.
And that's like when all else fails, default to a nice local raw honey, take a teaspoon and eat it. That'll hit your sweet tooth right away. Don't do that 20 times a day, but if like,
I just like some really dark chocolate.
there you go. Yeah, dark chocolate's great. So you're looking at 85%
Yeah, like
and up.
90-ish.
Yep,
I like one little square.
yep, there you go. Little things like that, just to get your brain back on track, so you're not feeling deprived. That's the only thing, you don't want to get into that cycle where you're just like in a lack-based mentality, because then you're gonna rebound hard. You're gonna hit that 30 days and you're gonna go right to Culver's.
Well, that's a good question, like, have you done this before with other, and what, like, from your perspective, after 30 days,
Mhm.
do people?
If people have actually stuck to this and they've kind of gone outside their comfort zone and started making things themselves, they've now developed habits and they've changed the way that they eat. Now people that have kind of like, I kind of did it like 70% on the weekends, I ate pizza or whatever, like they didn't do as well.
Pizza's bad?
Now let's go back to the first slide.
Once you've been doing this for a while, though, you could have pizza every now and then.
Yeah, so
I mean,
you
once
look
you're
at like the
doing this for-
80-20 rule
Yeah.
eventually, right? So if you get your gut balanced out, everything's like healed up and your body's not in that constant low grade inflammatory state, you can start to play, 80-20 rule. So you go to a party and you have a piece of cake or you have a slice or two of pizza. you'll probably feel kind of crappy.
You feel like
after
jumping.
you do it.
Yeah, you're gonna
Yeah.
start being like, it's not worth it.
Yeah, because like we've developed a certain level of tolerance for that inflammatory cascade in our body where we don't have those overt symptoms. But you get rid of that tolerance to that low level of inflammatory response, you eat it, you feel like crap. And people are like, I was never sensitive to that. Like, well, you were, you just didn't know that, you know, you were having like elbow pain or hip pain or gas and bloating and IBS symptoms. Like, that's what was going on under the level, like under the radar. Like, that's what was happening. And you weren't like directly, like you wouldn't eat a piece of pizza and be like bloated. You just have that all the time. And that was just your normal. So you get rid of the low level of inflammation. You reintroduce certain foods, you're gonna kind of feel like crap and be like, I don't wanna keep eating that. You're gonna have a different response to it. Did that answer the question? I feel like I went a little bit on a tangent there. Cool. Awesome.
No bread, no juice.
All right, so yeah, as, just make sure what you can do, let's see, I'll get a piece of paper and you guys can put your like email, just so I can double check what we have on file. And I'll send you a link to the Facebook group if you want to get into that, just let me know. And we'll kind of go from there. Sound good? Rock and roll. And if there's anybody else you know that would like to get in on this, like you can let them know too. They can have access to it even if they're not a patient here. The more people, this is all about educating the public, so game on.
That'll be
All
his
right,
excuse.
well, thanks for coming out, guys.
Thank you.
Start cleaning out those pantries. Let me know if you have any other questions.